Ladies and gentlemen, welcome to my channel, Nursing Education Tutor. My name is Cheryl Spencer. In this video, I'd like to talk to you briefly about a medication that is quite popular and very frequently prescribed. And that medication is furosemide with a brand name called Lasix. It's a very common medication, and most fundamental nursing students will see this medication, and it doesn't go away. It's a medication that you may learn about in fundamentals, and you'll learn about it as you go through your curriculum. You'll definitely see this medication again when you get to the cardiac diseases, primarily with a diagnosis called congestive heart failure. So let's start from the very beginning. So furosemide, the generic name, is a diuretic. And what a diuretic is, it diureses. It pulls water out of the body. It makes you urinate more. So a lot of people will refer to Lasix as a water pill, and that's okay to say in layperson's term. But when you're a nursing student talking to another healthcare professional, be it your instructor, your peer, please refer to it using the language it's a diuretic. So furosemide, that's what the classification is. So why would someone prescribe that? Why would a provider prescribe that? It's prescribed in several different diagnoses, primarily those that can cause fluid overload or excess fluid in the body, in the vascular space, in the blood. So kidney disease, you have to have a functioning kidney in order to diurese. So that's key thing that you'll be checking. Kidney functions, one of your interventions to check prior to giving that. Hypertension. Hypertension can be caused by constriction, high cholesterol, but you can also have fluid can contribute to a high blood pressure. Higher volume can cause high blood pressure. And a very common medical diagnosis that you'll see, that congestive heart failure, or CHF. So the problem is heart failure. It is the heart that's weak and not functioning well, and the symptoms or consequence of it is this congestion. And as you learn a little bit later, you learn about right-sided heart failure as opposed to left-sided acute heart failure. But in chronicity, it's just congestive heart failure, where the individual is either holding on to fluid. It could be in the lungs, and you assess that with your stethoscope, and you may hear rales. The person may have edema, may have peripheral edema as another assessment for fluid overload. Another sign is a bounding pulse. Strong bounding pulse can tell you that perhaps a person is fluid overload. So it could be for kidney disease, hypertension, congestive heart failure, some reason why. You could have an individual who has hypertension, and they may be on a beta blocker such as metoprolol. They may be on an ACE inhibitor such as enalapril, but it's not working that well to lower the blood pressure. The provider may add furosemide, and together with one or two of those medications, it can get a better outcome with the blood pressure. Well, as with all medications, it's wonderful. There's an intended effect that you want to achieve, but there could be some adverse effects. So you have a medication that's a diuretic, and it's pulling fluid from the body out. Any shift in fluid can cause an alteration in blood pressure, and you have to teach your patient to make those quick assessments. Teach your patient not to get up too fast. They can be dizzy. They could have confusion. Remember, any type of water imbalance, especially goes with sodium, can have some type of mental status imbalance. Teach your patient to get up slowly from a seated position. So because Lasix it's a diuretic, but it's called a loop diuretic. It's a fast-acting, work on the loop of Henle in the kidneys, and because it's such a fast-acting diuretic, it can also pull and filter more things out than you want to. So Lasix, one of the main consequence of Lasix, it lowers your potassium level. So normal potassium is 3.5 to 5.0. So if you are, prior to administering Lasix, which of the following should the nurse do? definitely check the labs. You want to check the labs to see what the potassium level is. You also want to check the blood urea nitrogen, the BUN, and creatinine. You want to see what the patient's kidney function is. Definitely want to check the blood pressure. And again, as a diuretic, you want it to work and pull the water. And one of the best ways to check to know if the water is being pulled right is to weigh the patient. So when a patient goes home, you teach them to weigh themselves daily at the same time every day. And, you know, especially when they have a diagnosis of congestive heart failure, they will get instruction as to how much weight gain we're concerned with per week. So in a nutshell, furosemide, Lasix, it's a diuretic. It's often given to help those diseases that have something to do with a water imbalance. Could be kidney disease, hypertension, congestive heart failure, anybody with fluid overload, rails. Based on that, there are consequences to it. It can cause somebody to be dizzy, confusion, some blurred vision. It could happen. Talk to your provider about that. Lasix can also lower your potassium level. And if it's lowered, you can teach your patients about foods that are rich in potassium. One of the main food we talk about is a banana. It's rich in potassium. Sweet potatoes are also rich in potassium. So a patient is being discharged home on furosemide. Which of the following foods should the nurse encourage the patient, including their diet? See, that's how you put it all together. So you want to encourage the patient to have a variety of foods, but you know, a banana is a good thing, a potato. Your first choice is never to have the provider order another medication. You know, if they can get those supplements from food in a natural form, it's ideal. But for some patients, indeed, they may have to get some type of potassium supplement, and that's for another day. That comes in pill form. Big white pill also comes in liquid form. So so that's really it. So in a basic form, you know, Lasix, it's a diuretic. You know, there are other diuretics, you know, whereas Lasix, furosemide gets rid of the potassium. There's another diuretic that holds on to the potassium. But whenever you have any type of fluid imbalance or any medication, either lets you hold on to fluid or diurese, it's really important for you to check your electrolyte levels. And I hope that helps. As always, if this is your first time to my channel, welcome. I hope you stay. Have a good day.